run through this list and grant everyone recording permissions. So I will do that real quick and then give you all a minute to get ready, and then we can get started.
I'm not sure if my request went through, but can you give it to Kelly at K2 as well? Sorry, Marissa.
Yeah, nope. I'm just going to go through the whole list and just let you, like everyone I see, let everyone record.
Thank you.
Okay, everyone should have permission to record. If you need it and I missed you, please let me know. Good. All right. So we can go ahead and get started then. I want to be respectful of all of your time. So thanks for joining us. I'm Marissa Armstrong. I'm the Senior Communications Specialist with Clark County Public Health. We have physician leaders from Clark County Public Health, PeaceHealth Southwest Medical Center, the Vancouver Clinic, and Legacy Salmon Creek Medical Center here to speak with you all. Each of them have a few things they want to cover. We'll go through one at a time and let them speak, and ask that you all please save your questions for the end. We will have a chance for everyone to ask questions. When it is time for that, if we could use the hand raise feature on Zoom, if you click on the little participants button and over you get the sidebar, you should have a option to raise your hand at the bottom of that. So if we could use that, and I can just kind of call on individuals so it can kind of keep everyone from speaking over each other. That would be really helpful. I muted everyone, so if we could just, if you're not speaking, please stay muted just to ensure everyone gets the audio that they need. That would be great. I think that's it, unless anyone has any questions before we get started. All right, so first up is going to be Dr. Alan Melnick. He is the Director at Clark County Public Health and Clark County Health Officer, to give you an overview on current case numbers and what we're seeing in Clark County.
Thanks, Marissa. Just to put this in perspective, the COVID-19 case numbers are exploding. They're rising exponentially. Use a number of adjectives for this, but they're going up in an alarming rate. And just to give you an idea, 8 weeks ago, in Clark County, we averaged 28 cases per day. 4 weeks ago, we averaged 42 cases per day. In the last week, we've had 845 cases, which is an average of 121 cases per day. And so the activity is continuing to increase. You may recall that we have metrics around COVID-19 activity. Under 25 per 100,000 for 14 days is low, 25 to 75 is moderate, and above 75 is high. In the last 14 days, our rate has been at 171.55 cases per 100,000 over 14. That's over 14 days. That is really high. And if we, given the last week, when we report out next week, it'll be even higher than that. The numbers are continuing to go up. Our data show that the case numbers are increasing across all age groups and demographics, with those between the ages of 20 to 49 consistently having the highest numbers of new confirmed cases. But that raises an additional concern because as those numbers go up over time, we're going to see that expanding into older populations where we're likely to have more severe illness and more mortality, more deaths. So and more hospitalizations as well. So we're very concerned about that. One last point I want to make is that the data also show that one really major risk in terms of exposure are these small private gatherings where people to get together, often in their homes, other private places, with people outside their household, and they may be close friends, they may be relatives. It's likely that in situations like that, people are more likely to, because they're more intimate private settings, less likely to practice physical distancing, less likely to use masks, and given the weather and the season, they're all more likely to occur indoors. So very concerned that these small private gatherings are a major risk factor driving this increased number of cases. That's, I'll leave it at that. Thank you. Marissa, did you freeze or I'm not hearing you? So I don't know whether your internet froze or not. Maybe I'll go ahead and introduce the next speaker then while she's working to get her. Sounds like I'm hearing from her. Yeah, Marissa's internet froze. So let me go ahead and introduce the next speaker while she tries to get back on. Dr. Ray Lee is the Chief of Staff at PeaceHealth Southwest Medical Center, and he's going to be talking about COVID-19 symptoms, when and where to seek care, hospitalizations, treatments, and recovery rates. So Dr. Lee, I'll turn it over to you.
Well, thank you. Good afternoon. I'm an emergency medicine physician, and I serve as Chief of Medical Staff at PeaceHealth Southwest. So let me start by discussing how COVID-19 is spread. The virus is spread primarily through respiratory droplets from person to person during close contact. The droplets are expelled when an infected person coughs, sneezes, or speaks. And with the droplets, the virus then enters through the eyes, mouth, or nose and travels down the throat. And in some patients, the virus travels down to the lungs. And when that occurs, it causes pneumonia. Pneumonia is infection of the lungs. And this leads to fluids filling the air sacs in the lungs, diminishing your lungs' ability to get oxygen, making breathing difficult. Another possible route of transmission is through contact surface spread, touching surface with the virus on it, and then touching your eyes, mouth, or nose. But this route is much less common. After an exposure, symptoms occur on average at about 5 days, and nearly all patients develop symptoms within 12 days. And that is why we recommend a 14-day quarantine after a potential exposure. The most common symptoms are cough, fever, and shortness of breath. Most patients with COVID-19 have at least one of these three symptoms. And other common symptoms may include muscle aches, fatigue, nausea, vomiting, and diarrhea. And some people may experience loss in sense of smell or taste. A major challenge to containing the virus is that people can spread the virus before they develop symptoms, which means a person can unknowingly infect others when they experience no symptoms or very mild symptoms. And this is called asymptomatic or pre-symptomatic transmission. In fact, an infected person is actually most contagious just before and after symptoms start. And this is why pre-symptomatic transmission accounts for about half of infections. When a person is infected, 4 types of illnesses can occur based on severity of symptoms. In mild illness, the person has mild symptoms of fever, cough, fatigue, but experiences no shortness of breath. The treatment is self-care at home and isolation. A person has moderate illness when mild pneumonia develops. The person experiences some shortness of breath, but generally mild, and still has a good oxygen saturation and does not need supplemental oxygen. The treatment is supportive care at home, but with close monitoring, and hospitalization if a person feels worse or is at high risk of getting worse. You should seek medical treatment if you feel short of breath, feel weak or faint, have bluish lips or fingers, or are confused. The majority of patients with COVID-19, about 80%, have mild and moderate illnesses. And it is important to note that, on average, symptoms peak around day 7 after symptoms onset. It is around day 7 people begin to feel short of breath and get hospitalized. About 15% of patients with COVID-19 develop severe illness and need hospitalization. They feel very short of breath, they need oxygen, and generally have more than half of their lungs filled with fluids. And treatment in these patients are mostly supportive care in the hospital with different ways to support oxygen level, and also include steroids to decrease inflammation, remdesivir, an antiviral medication to decrease the virus activities, may decrease time to recovery. And unfortunately, about 5% of patients have critical illness. They have respiratory failure and need to be put on a ventilator and life support. They sometimes have kidney failure and need dialysis. They can have multiple organs failing at the same time and can develop shock. Treatment for these patients includes supportive care and steroids. Remdesivir may not be as effective in this group. And the virus can affect virtually all organs. For patients with severe or critical illnesses, complications of COVID-19 include organ damage to the heart, brain, lungs, liver, kidney, and blood's coagulation system. And one thing we've learned about COVID-19 is that it increases the risks of developing blood clots. And blood clots can develop in large arteries. In the brain, it causes stroke. In the lungs, it causes pulmonary embolism. In the heart, it causes heart attack. That is why giving blood thinner to prevent blood clots is part of the protocol of treating hospitalized COVID-19 patients. When patients with COVID-19 are hospitalized, they tend to be hospitalized for a long time. On average, a person is hospitalized for about a week. And when a person is very sick and needs to be in the ICU or on a ventilator, they can be in the hospital for 2 weeks. Even when patients recover from COVID-19, some of them, about 10%, will develop long-term symptoms in what is known as post-COVID syndrome. They experience cognitive impairment, shortness of breath, fatigue, and are vulnerable to recurrent infections. They do not immediately recover and return to their normal levels of function. And mortality from COVID-19 varies substantially by age, ranging from 1 in 900 to those between 18 and 29 years old, to 1 in 5 between 75 to 84 years old, and up to 1 in 3 for those older than 84. In addition to age, other risk factors for severe COVID illness include chronic lung disease, cardiovascular disease, diabetes, obesity, sickle cell disease, chronic kidney disease, cancer, and folks who are immunosuppressed. Overall, among patients with COVID-19 who require hospitalization, the mortality is approximately around 15%, but can be up to 40% among patients requiring ICU care. However, 2 recent studies are showing a significant improvement in mortality among hospitalized COVID-19 patients. This substantial drop in mortality is seen in all groups, including older patients and those with underlying conditions. And this is encouraging news. The good thing is that we know much more now about COVID-19 than when we did in the spring. And thanks to the incredible amount of scientific and clinical research that has taken place since the beginning of the pandemic, science has informed our treatment. We've developed a rhythm and a standardized approach to treat patients with COVID-19. And as a result, we're able to save more lives. And we, the folks in the healthcare system, will be here for you, for your family, and our community. We're committed to providing the best care no matter the circumstances. But this is also where we most urgently need your help, and I'm asking you to be there for us. In order for the hospital systems to continue to function well, efficiently, and safely, we need to operate within our resources. We do our best when we operate within our capacity. Help us avoid the surge that could overwhelm the system. Please stay home when you can. Avoid indoor gatherings with folks outside of your immediate family. Wash your hands. And by all means, wear your masks. This is not permanent, but it is what we must do for now. And together, we will get through this pandemic. Thank you.
Great, thanks. I'm back. So thank you, Dr. Lee. Next up, we have Dr. Alfred Seecamp. He's the Chief Medical Officer at the Vancouver Clinic. He's going to talk to you about testing in the community, when and where to seek testing, and testing availability in Clark County.
Thanks, Marissa. As Marissa mentioned, I'm Alfred Seecamp. I'm the Chief Medical Officer for the Vancouver Clinic. And according to the CDC, considerations for testing include people who have symptoms consistent with COVID-19, so like Dr. Lee just stated, people with cough, fever, shortness of breath, loss of taste and smell, etc., should be tested. People who have had close contact with someone with confirmed COVID-19. And the definition of close contact is important as well. It's someone who has been within 6 feet of someone who is infected for a period of 15 minutes. And the period of 15 minutes is cumulative over a 24-hour period. So you can imagine a minute here, a minute there, 30 seconds here, 30 seconds there. It all adds up pretty quickly. So the importance of masking, once again, is extraordinarily important. And people who have been referred by their healthcare provider. In our community, we really test everyone that's being admitted to the hospital for surgery or induction of labor, or outpatient surgery, including colonoscopy. People get tested prior to that to keep our staff safe, to keep others around them safe. And that's been an effective strategy for us in our community. There's still a shortage of testing capacity in our area. So we've really been focusing on people with symptoms or known exposure. And tests need to be ordered by a healthcare professional. If you are tested, you should self-quarantine and isolate at home until the results of the test are available, and follow the advice of your healthcare provider. Additionally, if you have had close contact with someone who has COVID-19 and your test is negative, you still need to quarantine for that 14 days. It has to do with the infectious period of the virus. And a negative test may still put you at increased risk for spreading the disease in the future. So we really need people, even if you've had close contact and you have a negative test, you still need to quarantine for that 14 days. That's an essential public health intervention. At Vancouver Clinic, we've had to prioritize and adjust our testing criteria to meet demand, and the demand continues to rise. Currently, we're seeing a 20% week-over-week increase in testing demand. And to be able to meet that demand, we've recently added a third testing platform so that we can meet the needs of our community and any increase in demand that occurs. We're currently testing about 2,700 patients a week, and through the increased capacity that we're bringing online, we hope to be up to 10,000 tests by the end of December. It's important for us to have the ability to test symptomatic patients so that we can differentiate between COVID-19, the flu, and other respiratory conditions. Why is that important? Well, at least part of why it's important is we need to contact trace folks that have COVID-19 so that we can have other people come in to be tested. And the treatment is different if you have flu or other respiratory illnesses. So we want to be able to customize the treatment so it's appropriate for the condition that the person has. I'd also like to quickly mention that some states, like Alaska and Hawaii, require pre-travel testing. But with cases climbing, the governors of Washington, Oregon, and California on Friday advised people to not travel. So I would recommend you stay at home. Non-essential travel is off limits for the foreseeable future. And as Dr. Lee also talked a bit about, we are entering the holiday season. As Dr. Melnick mentioned, small gatherings now are the primary source of spread. Consider virtual family gatherings. That's a very safe way of having people together. If you must get together, being outdoors is way better than being indoors. The air circulation is orders of magnitude better. And the governor of the state of Washington has said that if you are thinking about getting together for the holidays with people outside your immediate family, those people need to quarantine for 14 days or quarantine for 7 days and have a negative COVID test 48 hours before. I think the best advice still is to get together with your immediate family and not bring in a lot of people. We, as Dr. Lee just mentioned, I think working together, taking this seriously, we can all bend the curve, to use Dr. Fauci's words, and create a healthy community. So next, I'd like to introduce Dr. Hua Lee. Dr. Lee is the medical director at Legacy Salmon Creek Medical Center, and he's going to talk to us about prevention, safety, and that topic on everyone's mind, holiday planning.
You're muted. Oh, you got it.
Okay. Hi, everybody. So each of us is faced with a very tough decision this time of the year. We have to deal with three different things, right? It's the family tradition of gatherings, and everyone is looking forward to those times when families, grandpa, grandma, and kids come together. We're also faced with this exponentially explosion of COVID-19 pandemic. On top of that, each of us also experiencing pandemic fatigue. We're tired of pandemic, so it's very hard for us to overcome those emotions and try to get ourselves together and make those tough decisions. What we hear from the CDC, from the governor, Washington State, from Clark County Health Department, we all have sent messages urging you to stay home. Here are just a few highlights. You hear from the governor that no gathering in-house, indoor, unless the guest or family member is quarantined for 14 days or quarantined for 7 days and tested negative. Outside gatherings limited to 5 people. And however, if you really want to have people gathering, the outdoors is the best place to be. Even then, make sure that we have good social distance. We have enough room for people to be, at least 6 feet apart. Make sure that we all practice safety, wearing face masks, avoid physical contacts, avoid sharing food, drinks, utensils, avoid touching surfaces that are around. Like Dr. Ray mentioned, they can be transmitted by all those modes. So we understand how they get transmitted, and so we understand why these strategies work. Of course, the hand sanitizer is another important thing. Do it diligently all the time. And so even after the gathering, people have to put themselves on quarantine for another 14 days to make sure that they don't asymptomatically transmit the virus. So those are really brief highlights about the holiday gathering. Ideally, focusing on your family, the people in the same household, and expand it virtually if you can. But by all means, avoid gathering with people outside the home. You hear the message from basically all of us today. The difficulty is, how do we do that? We have the need to gather. We're a social animal. We need to meet with people. And we have delayed that for a long time. How do we do it now? It's very difficult. I'm with you. But we also are spiritual beings. I mean, we're fully capable of making sacrifice for a higher calling. We are capable of making a difference for ourselves, for our loved one, and for our community each day. Remember this, the virus is very dangerous and powerful, but the virus can only do what we allow it to do. If we have no host, if we don't have gathering, if we're not giving it the opportunity to spread from one person to another, the virus will disappear. It is in our power to defeat this virus if we choose to work together mindfully, responsibly, in all ways we can. So how do we do this? Personally, how do I do this? I mean, I work in a hospital. We all cause, heroes and all that. We also have our families, and we have to deal exactly with the same thing that everyone is dealing with. For me, it's a matter of taking it one day at a time. You can look at the pandemic as what's happening today versus taking, looking back and say, oh, it's been 6 months, 3 months, it's been horrible. But if you take it one day at a time, it's a little bit more easier for you to deal with. Yesterday's gone. Tomorrow, we don't know what happened, but today is where we can make a difference, where we can decide what to do today, and that make a big difference in how we approach this. Make every day day one. And every day, we have a new opportunity to make a difference. Every day, we can decide that today, I'm gonna do this. I'm gonna avoid gathering, I'm gonna put a mask on, I'm gonna give examples to my kids. Doing this is a message of love. Doing this is the message of love your neighbor, of social responsibility, of good citizenship. For the kids, for the family, how do we tell them about this? What I would tell my kids is that they're heroes by wearing the mask, by keeping social distancing. They're heroes because they help reduce death rate. They're heroes because they help us in this war against this virus. They're heroes because they help us to defeat this common enemy. Not just us healthcare workers are heroes. Each citizen, each individual is a hero in this war against this virus. Keep that in mind and share with your kids that. This may not be the best holiday season because they can't see their grandparents and have family gatherings and see their cousin. But this is probably going to be the most memorable and meaningful holiday season in their lives. This is something that they're going to be sharing with their kids, their grandkids for years to come. Their grandpapa, grandma, survived this pandemic and contributed to its defeat. So let that message to be very strong to everyone in the community, that together we can make a big difference. If we commit it, let's start every day as day one and start making a difference. Thank you.
All right, so we have some time for questions. If folks have questions, and could please use the little hand raise feature by clicking on the participants button, and then in the sidebar you should have the option to raise a hand. I'll go ahead and just call on people as I see them, and you could direct your question to one of the specific speakers, or if it's a more general question, we can let whoever feels up for answering take it. All right, so Kelly Azar, why don't you go ahead?
Hi, everyone. Thank you so much for taking our question today. I'm not sure who this goes to, so I'm just going to put it out there and let whoever wants to answer take it. As we've been getting these releases from Clark County Public Health about new deaths, we're seeing a number of them say that they're dying at home. And we're wondering, are people not coming to the hospital when they need to be? How is this happening? And what would you say to folks who maybe are at home right now, not feeling well and not sure what lies ahead?
Well, I can start. I mean, I think we want everyone to receive the medical care that they need. You know, we have our outpatient practices are open and ready to see patients either in person or via video visits. You know, as the incidence of COVID-19 increases in our community, video visits are a wonderful way of making a connection with a healthcare provider. And certainly our hospitals are prepared to take care of people as well. So that fear of going into the hospital or making contact with a healthcare provider, really that's something I think that we as a community of healthcare professionals, of media professionals need to get the word out, that it is safe to come to the doctor, it is safe to contact your healthcare provider, and it is safe to go to the hospital if you need to go there.
So this is Dr. Hua Lee from Legacy Salmon Creek. I would like to add to that. So as the COVID pandemic continue, we're seeing more and more patients have recurring hospitalization because of COVID-related illness. And many people chose to go home on hospice care. So we see an increased number of that. I'm not sure, I don't have the data with me, but it's possible that some of these patients who died at home were being sent home based on their choosing to go on hospice.
Thank you. And I do have one other follow-up for whichever doctor might be willing to. At what point are symptoms severe enough that folks should be contacting their physician? Many of us, you know, we've had the flu and we think, oh, we can tough it out. But at what point should we be stopping and saying, no, maybe I need to go get professional help?
I can start with that. So I think on the front end is that there are sort of some guiding symptoms. I think if you feel short of breath, if you feel like you're having trouble breathing or struggling for breath, that's the number one reason to seek urgent medical attention. Or if you just feel so weak and so faint, that is also of concern. And if you're confused, or if there are visible signs that your body might not be getting enough oxygen, if you feel like your lips or fingers are sort of not, slightly bluish, I mean, those would be some cardinal symptoms to come in to get help. I think even better, I know this may not be available to everybody, is if you're able to have a oxygen, pulse oxygen at home that you can measure oxygen level. I think, 93, 94%, when you drop below that, you would want to get help. Or if you have a blood pressure machine, your blood pressure is very low. If the top number is below, 100 or even 90, you should definitely go get help.
I think just making contact with your provider's office if you're not feeling well. Then other things can occur, whether that be a video visit. You can often tell when people are short of breath just by looking at them talk, and then recommend that they come in. And testing still is an important adjunct as well. We want to see, make sure that if you're testing positive for COVID-19, we have contact tracing to do, and other interventions. And if you do, we also test people for the flu, and the treatment for the flu is different than it is for COVID-19. So, I think getting tested, getting things ruled out, going through a normal medical evaluation, and then customizing treatment based on what we see is important. But I think a good first step, if you're worried about COVID-19, is to call your provider's office and consider being evaluated.
About hospital capacity, with the numbers rising as quickly as Dr. Melnick was saying, how are our hospitals keeping up, and how is capacity right now?
So this is Dr. Harley from Legacy Salmon Creek. So we meet pretty much daily to talk about this. And, one of the immediate plan is to decrease surgical volumes by 25%. So we decrease the scheduled surgery to increase capacity. Currently, the hospital is pretty full, but we're still not overflowing at this point. So we can handle the volume at this point. But that's the first step. And then as we go further, we may have to cut back more of these elective procedures. There's plan to expand non-traditional beds as well if we need to other areas in the hospital where we can take care of patients. So we have steps that we take as we go forward.
Yeah, and we're taking similar measures at Southwest as well. We have a surge plan that's according to different phases of a capacity. And I think, Southwest and Legacy share probably a lot of similar blueprint. But I want to speak to this as plainly as I could. The stakes of our personal decision before us right now cannot be higher. I think all personal decisions about, adhering to ways to temper the spread of virus will have tremendous impact on whether our hospitals are overwhelmed in 2 weeks or not. And avoiding hitting that threshold, avoid hitting that surge capacity is going to be a gift to our community. We have surge plans, but we hope not to have to go all the way to phase 4. So this is the time, this is a critical junction to really temper the spread.
I'd like to add another thing. So when we talk about wearing masks, social distancing, saving lives, one thing that people don't realize is that you can save life by not being sick and entering the hospital. Because hospitals have limited resources. If you get sick and you take away that resources, that resource could be used to save someone else's life. So it's not that, especially younger people, they say, well, I'm not likely to die from this, so if I get sick, I go to hospital. That's the resource that you utilize, and that can be saved for someone else. Thank you.
If I can add just a little bit to this, is when we talk about hospital resources, we're not just talking about beds, but we're talking about the doctors and the nurses and the other caregivers who work. We have amazing partners, as you can hear on this, on this media briefing here, but not only do the beds get taken up, but this is an incredible impact on the workforce, the caregivers, and their families as well. And I'm not only concerned about bed capacity, but I'm concerned about being able to sustain this if the numbers continue to go up in terms of the staffing. And our partners here have surge capacity, including surge capacity for staffing, but at some point the numbers get exponential. You can reach limits here. So not only do we need to preserve our beds, but we need to preserve our physicians, nurses, and other care providers as well.
All right, let's go over to Wyatt Steiner.
Thanks, Marissa. I have a quick question. Alfred, you had mentioned that there's still kind of a shortage of testing in the area. I'm wondering what's kind of contributed to that. What have been maybe the problems in trying to ramp up testing?
Yeah, I think it mostly has to do with inventory, supplies, reagents, all those kind of things. I think the good thing is that all of our organizations have redundancy in our system, so that we have different testing modalities to be able to, if we don't get supplies from organization A to do our tests, we can move to test B instead. In the early phases of the pandemic, we really were short on testing supplies. Things have improved significantly. But with increasing demand, as Alan was just saying, it's going to stress our infrastructure. We as an organization at the Vancouver Clinic have staffed up or are increasing our testing capacity considerably to be able to meet that need, as are the hospitals. So we are all kind of working together to do as much as we can. In an ideal world, you'd want to test a lot more people than we currently do regularly. But we still are hampered by, not an infinite supply of testing kits or reagents. But we're certainly better than we were 6 months ago.
All right, so let's go to Genevieve.
Hey there, thanks for taking our questions again. I'm kind of going to piggyback off of what my colleague Kelly was asking about when it comes to hospital capacity, and I'm hoping that each doctor with the different hospitals can explain exactly where they're at. When we take the numbers right now, where do we stand in hospital capacity, and how close are we to actually being maxed out?
Well, this is Hoa Lee. To tell you the truth, I'm not prepared for this question. So we are close to 100%. I don't have the number, okay, but we've been able to maintain that. That's why we start cutting back on 25% of elective surgery. But I apologize, I don't have the exact number for you right now.
Likewise here, I can't tell you a percentage. I know we're not at full capacity, but I think as Dr. Millick has spoken, is the capacity is, again, not just physical capacity of beds. It's really about the ability to staff to the maximum physical beds. I can tell you that we're housing about 35 COVID patients right now. And we have about, if I'm correct, 5 or 6 in the ICU. And we have been hanging around about 35, 36 patients for the past week or two. And that is much higher than what we were housing in the spring. So we're seeing definitely more COVID patients. We're taking care of more COVID patients. And if you remember, as I said, COVID patients, they stay in the hospital for a long time. So every admission of COVID patients means a bed is taken up for a week or two. And that is something that's going to have a cumulative effect. So, to get back to the question, we're not at full capacity, but we're monitoring that daily.
Genevieve, if I can add a little bit to this, one of the metrics that we look at is percent of hospital beds that are occupied by COVID-19 patients. And about, a month, 2 months ago, it was around 4 to 5%. We want to be below 10%. More recently, it's been creeping up, and more recently, we're between 8 and 9%. I want to make a couple of, so that's in terms of bed use. And obviously, we're not quite there yet, but you've already heard that Legacy is beginning to cut down on elective surgeries because of the concern about capacity. So that's already having an impact on folks who are looking to have those procedures done and having to put that off. But the other point I'd make, and I think I made this earlier, is that we're seeing the largest number of cases right now in 20 to 49-year-olds. And my concern is that given the way the virus transmits, you can't keep it confined to that demographic. We are going to see more older folks become infected, and those numbers, they're more likely to require hospitalizations than the younger population. And if we wait, this is a plea because I'm really concerned about the Thanksgiving holiday coming up. If we wait until we get to that point, then it's like turning the Titanic around. I mean, once you I can use a lot of metaphors. Once you let the cat out of the bag, or however you want to call it, it gets really, it's very difficult to turn that around once you have that widespread transmission. And we're heading in that direction. The indicators are such that we are heading in that direction. So I want to express that concern as well. Right now, today, we have hospital capacity, but as you know, there's a lag between transmission, getting infected, getting sick, and then requiring hospitalization, and that could be several weeks.
Yeah, I wanted to piggyback on that, Dr. Malik, about this lag time. So if we are seeing weeks, or we are repeatedly having 2,000 plus cases, what kind of impact will that have in 2, 3, 4 weeks from now?
Well, that's the concern I have. If you can look at what's happening in other states around the country that are ahead of us in terms of their, you look at the map of the U.S. and you look at the case counts, and you look at what's happening to some of the states east of us. They're already at that point where they're, you've seen it on the news, where they're reaching their capacity or beyond. And you might notice that, in terms of case counts, as bad as it is here, Washington State, in terms of incidence, is one of the 10 lowest states in terms of incidence. But we're heading in the wrong direction, and we are very likely, if we continue on this path, to see what's happening in other states to the east of us that have higher rates.
It's like with the Legacy system, we have 68 COVID patients right now. Salmon Creek alone have 17. So we definitely see an increase. A few weeks ago, we have like 10. So it's almost double. So if it continues to go at that rate, the next few weeks, we're going to see it growing, doubling in number.
Yeah, I don't have the numbers right in front of me, but if you add 17 and 35, you get, 52. But if I can remember correctly from, July, when we were looking at the hospitalized numbers, it was like 20 or so. It was, so and then, we've had this increase. It was in the 20s until several weeks ago, and now we're up to 52. So we're heading in the wrong direction.
We are. The other thing that worth mentioning when we talk about hospital capacity, like Dr. Malik mentioned before, it's not just the physical bed. We're facing another issue with staffing illness. Staff being on furlough and calling you sick as well. So that's a very dynamic number for us to follow.
Okay, I had one quick follow-up to that as well. Talking about, I've heard, I think each of you guys mentioned these surge plans that you have right now. What does that mean, and what are the different stages?
Well, I can just use one example. Let's see, we have a surge plan for the ICU, and that the surge plans are in different phases, and each phase reflects how many COVID patients are in the ICU. And as the number increase, we need to deploy more physicians. We have plans in place to make sure that we're able to take care of more and more COVID patients in the ICU. It's both, figuring out resources, both in people, in ventilators, and physical capacity to be able to do that.
So legacy is similar. I think that there's two plans. One is for the ICU patient and one for the non-ICU patient, and they have to work hand in hand. So right now we have like 16 bed capacity for ICU patient. I think 5 or 6 of them are only occupied by COVID patient. One that's full COVID plus non-COVID patient, we may have to move to the next unit and change that into an ICU capacity to open up another 16 bed. So what it means is that for the non-ICU patient, we have to find capacity for those. So then we have to start exploring non-traditional bed, looking at recovery room, looking at pre-surgical rooms, looking at even surgical suite to turn them into patient room. So it's a pretty extensive, detailed work that is very dynamic. It's being revised and looked at all the time. And we are in the process of reviewing that again. What you're going to see is several things. Physician may have to work more hours, see more patients. We are asking for community to help. In the beginning of the pandemic, we put together a community volunteer service. Physician from outside willing to commit certain hours. We compiled that list. We have not activate that yet, even in the first phase of the pandemic. But that's another potential resources we can bring in from the community. And kudos to all the community providers. They are very on top of this, and some of them said they volunteer to come in to clean the floor or wash the car for me to see the patient. They would do anything. This is such an incredible place to work, and I want to call out that we have retired physician, we have everyone trying to contribute, but hopefully we don't get there.
One other thing I want to add is that it's mid-November now, and we're not yet into flu season. We're monitoring the number, the percent of lab tests for flu that are positive. It's how we measure it. We're not there yet. But my other concern about capacity is, you add influenza to the mix, and that puts our numbers are. What I guess the point I'm making, our numbers are heading in the wrong direction, and we haven't even entered flu season yet. So that could be a double whammy in terms of hospital capacity.
And just from the outpatient realm, the Vancouver Clinic is an integrated outpatient delivery system. We're trying to kind of head people off from going to the hospital, so evaluating them for things that can be taken care of in their doctor's office or in urgent care, and working closely with our hospital partners to have non-urgent things be taken care of in the outpatient realm. So I think that is one of the really positive messages, as Hua and Ray and Dr. Melnick were saying. It's a community that really works together. We're in dialogue with one another all the time, trying to help each other out and ultimately help our patients and our community out as well.
Thank you.
All right, Lindsay Nadrich.
Hi, thank you for taking the questions. My questions, I guess, are for Dr. Rayleigh and Dr. Holy. We've continually reported on the numbers. We're getting close to hospital capacity, and we continue to see cases surge. So I'm wondering if you personally can describe for me what it is like to watch the case numbers go up. What does your day-to-day look like? Are you working directly with COVID patients? And really paint that picture for people, because we don't see it. We're out in the community. We hear case numbers are going up. That seems to not be enough to make a difference. So for you personally, what is it like to be treating patients and really get that message across for people who maybe aren't taking this seriously?
I guess I can start on the front end. I treat patients in the emergency department. And so first of all, we are definitely seeing patients who are coming in, and more patients are testing for positive for COVID. So we're kind of seeing folks in two categories. One is that we have patients who are coming in 5, 6, 7 days after they test positive. If you remember, symptoms peak around a week. They feel fine a week before, but steadily getting worse. And then usually around day 6 or 7 is when they start to really feel short of breath. And that's when they come in. And in the emergency department, it can be a little tricky because, it's hard to know if someone has COVID or not. So there is a lot of, precautions are being taken. We wear PPE if there are indications to do that. And it's definitely, we're seeing an increasing burden of COVID patients and suspect COVID patients. And it can take a toll on the staff. So I think it's even more important that we, again, as a community, do what we need to curb the spread.
I agree. This is Wally from Salmon Creek. I think it takes a big emotional and physical toll on the staff. Seeing this patient getting really sick, not being able to have family members around. Some of them we have to talk to interpreter. Some of them we communicate while we're wearing PPE for PPE. We see some patients get sick very quickly within hours. They move from the medical floor to the intensive care unit and get to put on ventilator. The staff continue to have anxiety. Is facing this every day. They still have anxiety. They still have fear of bringing it home to their family, or fear that what if they get, infected. I personally have an isolation room set up at home. In case I come home and can't, get in the house, I will enter that isolation room to protect my family. So all those things, we have to deal with. That's the reality. But from the medical director perspective, it's hard to maintain, the morale of the staff and, to stay positive and strong. We all try, and I know every one of us do. But that's the feeling, in the hospital. Not just looking at the patient, but talking and looking at the staff themselves. I think it's a significant emotional toll. And I'm so glad you asked the question, because I think the community out there need to hear this. Because we have family like everyone else. We have the same concern. We need a haircut too, for everyone. And yet, we have to deal with this every day. And our fear is there. So, again, having said all of that, it's not a matter of, getting sick, go see the doctor, get in the hospital, get treated, and go home. This time is bigger than that. So keep that in mind, when you put on that mask, keep that social distance and avoid the gathering. keep that in mind. Keep us in mind.
All right. So I just want to say it is 2 o'clock. There's a couple more folks with questions, but I want to be respectful of everyone's time. If you need to go, then we can see who can stay on and answer the last couple questions. But anyone who does need to go, I just wanted to kind of give you that out, that it is 2 o'clock and we said we'd end at 2. If anyone is available to stay on, I had Chris Brown up next, and then after him, Pat Doris and Katie Fairbanks. So Chris, go ahead.
Thank you, everybody, for doing this. I wanted to ask, the governor's order basically says 14 days of quarantine before a Thanksgiving gathering, if you choose to do so. Obviously, now we're within that window. So if you didn't start that quarantine already, the other option he mentioned was 7 days and then a test within 48 hours. My question kind of goes back to the testing capacity. Let's say we have a rush of people who come in the middle of next week and want to get tested so that they can hopefully do their Thanksgiving gathering. Do we have the kind of capacity and the ability to deal with that sort of demand that pops up next week?
I think we do. I speak specifically of the Vancouver clinic. We do have capacity to be able to do that. And I think the message that we want to deliver is don't. Stay with your family, the people that are within your house. Try virtual options. Testing can give you a false sense of security. As others have already mentioned, you are most symptomatic when you don't know it. And if you have a negative test 48 hours ago and you are brewing the virus, you may be at your peak during the Thanksgiving dinner. Yes, I think there is testing availability for folks, but the medical recommendation is not to invite people from outside your home into your house for Thanksgiving dinner. Do it virtually, or if you must do it outside.
All right, Pat, Doris.
So thanks for being here. This is very impressive, and I think it's unprecedented, really, to have the medical directors coming forward like this and talking to the community. So I'm wondering, how much are you concerned that there's sort of pandemic fatigue, and that even though these warnings are going out, people just aren't listening?
I'm very concerned. That's why I'm so happy that we're doing this. I think we're gonna continue sending this message, because there's no other way around. There's only one way. We're gonna power through this. It's gonna be over, but people need to be reminded that it's in their power to do this. And I think that people can do things. There's a saying that if you know the why, you can do anything. And if you keep that in mind, that what you do is meaningful, responsible, and coming out from love, if people keep believing it and remembering that, they will do it.
Yeah, I agree. And I think, we've been going through this for several months, and I think people have been feeling isolated, getting really tired of this. And then you have the pressure of the upcoming Thanksgiving holiday. Thanksgiving, if I can think of any holidays that are, this is the poster child holiday for family gatherings, intimate gatherings with people from outside your immediate, the folks that you live with, which can include, cousins, aunts and uncles and all that. And given the isolation that people have been feeling from the pandemic, and then the need for social interaction, and Thanksgiving holiday is really tempting for folks, given their pandemic fatigue. And that is exactly what I'm concerned about, because of, we've seen a bump in previous holidays, but Thanksgiving could easily put us over the edge, already over the edge, but further over the edge. That's why I'm really so thankful to our medical leadership here for coming together to have this conversation, because I think we all really share this concern.
And I'm just so very thankful to the media, because through you guys, this message is going to get sent to every person around this community. So thank you so much, for the opportunity and for doing what you do. I have an update. The hospital capacity, Salmon Creek, 73%. I just have to get that number, sorry.
All right, I think last person I saw with the question was Katie Fairbanks.
Yes, thank you. I'm up here in Cowlitz County, so I'm not 100% sure if you guys can answer this question, but I know that we had been sending a lot of our hospitalized virus patients down south to southwest there from our PeaceHealth hospital here, and I just didn't know if there was kind of a plan or some sort of concern about having to kind of open a COVID unit up here in Longview, kind of if there's any sort of contingency to do that if things get a little bit overcrowded down in the Vancouver area.
I haven't heard of a specific plan with regards to Longview, so I can't speak to that.
One thing I can speak to, I'm also the health officer for Cowlitz County, as well as Skamania, Wahkiakum, and Pacific County. So the numbers in Cowlitz County are skyrocketing. So so to be at 25, being that low level of 25 per 100,000 over 14 days, you've got to have about 2 cases a day in Cowlitz County, given the population. The last week, they've been averaging around 20 or more cases per day. So they're at, they're seeing the same kind of spike that we're seeing in Clark County and the rest of the state of Washington. So we have a real significant challenge in Cowlitz County. I think PeaceHealth St. John's has been sending the COVID-19 inpatients to PeaceHealth Southwest. I think that's been, I think from that standpoint, it's been the most efficient way to have a, COVID-19 dedicated staff, and Dr. Lee can probably speak more to this than I can, than having that spread out. But, when I look at hospital capacity, I look at all the hospitals in Southwest Washington, including, Legacy, Salmon Creek, PeaceHealth St. John's, and PeaceHealth Southwest. So whether or not the patients are moved to PeaceHealth Southwest, given the numbers that are skyrocketing in Cowlitz County like they are in Clark County, we're all basically in the same boat.
Thank you.
All right. Well, I think that's it then. Thank you everyone for joining us, and thank you to all of our physicians for taking the time and joining up with us. And we will end it there. Thanks everyone.
Thanks, Marissa. Good to see you again.
Thank you, guys.
Thank you.
Thanks, everybody.
Thank you.
Thank you.